Recovery is at the heart of what we do at Greater Manchester West, in the sense of giving people hope and optimism when they're living with a long-term mental health condition. So the Recovery Academy is a vehicle where we can bring our service users, our carers and our members of staff together to help work through skills, life skills, etc. that we can work together on, and provide courses and also opportunities for people to have meaningful activity and possible employment.
It's such a forward-thinking programme. It's really good to see that there's a gap in provision that's being provided now, because it's often you get very kind of low-grade programmes for service users and then mainstream college. This is the perfect in between, giving people the confidence to move on.
But the recovery aspect is to maintain that compassion, that hope, that optimism that we all want in everyday life. But those little successes can build your confidence, and that's what's so important in living with a long-term condition, because you will have times where your condition will not be so good, and it's how you manage that and the resilience you will have to manage that. So that's about supporting people, and not only themselves, but perhaps their families or their loved ones, in that when the times aren't so good, how they can work through and manage their symptoms.
Well, GMW have recognised the important role that carers of people with mental health problems play for a number of years now, and so obviously we wanted carers to be involved in the Recovery Academy. So we have a course that's going to be run throughout the trust at different directorates, different parts of the trust, called Caring with Confidence. This course has been developed with carers, and it will be run with carers as well.
We run the courses in a number of venues because we want them to be as accessible as possible for people. So there may be at Prestwich Hospital, we've used the Octagon Theatre in Bolton, and we're very keen to use leisure centres and other types of colleges, etc., where we can get rooms to help people access employment.
All the courses focus on supporting people in their recovery journey and promoting health and well-being. We have a Living With series which focuses on understanding really the different mental health conditions that people might experience. So for example, within that series we have living with bipolar, living with psychosis, living with eating disorders, living with self-harm, etc, etc. And really that's about developing people's understanding of maybe their own illnesses, or developing carers' understanding of something that one of their loved ones might be going through, and also developing staff's understanding, because it's coming from people with lived experience.
I think the courses are very well written. I think, you know, and they're delivered very professionally, and there's something for everyone as well. I think that's the key. Is you know, there's a course for everyone. You know, I did the Recovery Star, that was co-facilitated by a service user and a psychologist. That was excellent.
We offer courses which are really around supporting people within their recovery journey through basic psychosocial interventions. And so people who might be thinking of moving on, or who might want to volunteer or enter the trainer bank with the Academy, we offer courses around building self-confidence, group facilitation skills, train the trainers courses.
In the first prospectus that was out, there was 11 courses in it. Come the end of September this year, I'll have studied on all of them. I've learned an awful lot about things. So a lot of the things I've actually learned from these courses have actually helped me think about, you know, what recovery means to me, and about planning for the rest of my life, tips, pointers about how to go around doing the right things, maximising my chance of staying well, minimising my chance of becoming unwell.
You know, I am an ex-service user and still have bouts of depression, but what it has given, it's given me a new momentum to keep going. That's what it's done for me personally. And it's using a lot of ideas of my head's floating with new ideas for the courses. So it's brought that, it's reinvigorated me really.
And at first I was very unsure, But as time's gone by, I've started to really enjoy doing the courses, getting involved with people in designing and hopefully delivering future courses. And I feel like I've got a purpose, a meaning to my life. You know, I get up in the morning when I've got something on that involves academy work or academy courses. I kind of get up and I get on a bus or a train or a tram somewhere, and it makes me feel really good, like I'm actually going to do something worthwhile and something I might gain and benefit from, and hopefully try and maybe help somebody one day who's also got an unfortunate story.
We deliver the training in partnership with people with lived experience, so all courses within the prospectus are written and produced between professionals and people with lived experience, and they're facilitated by those people as well. One thing that we've done at GMW's Recovery Academy is to set up a trainer bank, and that really is an opportunity for us to pay people fairly for their contribution.
For our patients, service users down at our adult forensic service, their ability to access a general recovery academy can be challenged in terms of their leave arrangements or simply just the opportunity to get out of the unit and get to where the courses are. So what we want to do is mirror the Recovery Academy courses down at our adult forensic services so that patients within the secure perimeter can access the opportunities that other patients and service users are getting access to.
I wish that when I was at the beginning of my process of coming out of the Eden field, I could have had a bit of support, a little bit more support, and this would have been a lot better, really beneficial for me. So I'm hoping that this can help other people and I can be a part of that.
I think it's absolutely fantastic, and I think, you know, the right people are involved at the right level. You know, everyone behind the academy really believes in what it can achieve. You know, I think, you know, the people of Edenfield are very lucky that they're going to have this opportunity to really learn something and develop.
There's nothing more powerful to help transform somebody's experience of recovery than seeing somebody that's made that journey through our services and actually kind of show, you know, things may be difficult now in terms of where you feel you are in your journey of recovery, but there is light at the end of the tunnel, and some of our service user volunteers are real champions in terms of inspiring our current patients about what they need to do, how they can make best use of the services and prepare for moving on and ultimately getting your life back.
I'm a service user volunteer, and you know, I needed something to refocus myself and to get involved with, and this has given me that. You know, hopefully in the future I'm going to be more involved further down the line. You know, it's helped me to refocus and give me purpose again. I think, you know, and I've spoken to a few other volunteers that are involved, and I think they feel very much the same, that it's given them that spark in the life, and you know, it's given me I mean, I've done other things in a voluntary capacity, but this by far is the favourite thing I've ever done, I think.
For a lot of people, they say that recovery for them is leading a meaningful and purposeful life, and one thing that I firmly believe in is that for any of us, through the experiences that we have in life, at any one time we can lose our health, be it physical or mental health. You know, we know from the people that we work with, we can lose our homes, we can lose our finances, we can lose pretty much everything around us. But for me, education is something that can't be taken away from you. So once you've got that education, whatever else happens, you have got that, and it supports people to be able to move on.
Give it a try.